Yesterday we met and we had a VIP meeting, and we spent a lot of time with the advocacy group, and we got a lot accomplished, and I just want to share with you what we accomplished yesterday. It's a project that Dr. Goldhaber's working on, I'm working on, and Kathryn's working on, and we're trying, from our group that Dr. Goldhaber and I started 19 years ago, we're trying to replicate this group and get it to start up across the country. Our group, and actually I see all my little friends here today from our group, we meet once a month, and that's 90 minutes. We place for patients to get emotional support, learn up-to-date information about DVT and pulmonary embolism, and it provides peer support for themselves. We actually now have currently 180 electronic members. The goal is to replicate the PE support group throughout North America. We provide the tools to get you started. We actually did a facilitator's guide, and we send that out, and you actually provide the manpower. It requires a very limited time commitment of 90 minutes, and that's 4 to 6 weeks for a meeting. And you don't actually have to follow, we do it, usually once a month, but if somebody else wanted to do it 4 to 6 weeks or even every other month, that's totally up to them. And it requires, Kathryn, an hour of administrative work. For us, it's very low cost. We actually use a room which is very conducive at the Brigham and Women's Hospital, so that works out fine. Our only requirement that we're asking the groups is to have a healthcare provider at each meeting, and we find out this works better because if the patients do ask questions, you actually want them to have an accurate answer and not something that they may have got online that's not actually correct. We have currently groups that are interested. They're starting in Canada, Florida, California, Pennsylvania, and Illinois. Yesterday during our committee, we had suggestions for nationalizing PE support groups. 2 key components was to increase online presence, utilize Twitter, Facebook, video blogs. Dr. Goldhaber and I did a video blog on the PE support group, and actually put these on the NATF website. We thought it'd be a great idea to encourage more face-to-face interactions, have our presence, either Kathryn or mine or both of us, at medical conferences and grand rounds. Also to increase media presence. There were people in the group yesterday that plan to contact a PR firm and local media. We have a new member of our group who's actually 16 years old, and he suffered a pulmonary embolism, so he's going to get very much involved, and hopefully we can target the teens, even though there aren't a lot of them. If we have the information, it would be great. Then we had a patient education piece. I actually have Piano for Dummies, I have Spanish for Dummies, I have a couple of others, and we thought we might author like VTE for Dummies or DVT and PE for Dummies. Educational videos on NATF website. We're going to plan to put maybe video our own support group, and so people can see how it's actually run. We'd also like to have a patient health education day, where patients can come and just ask, questions of us and make it a heart-healthy lifestyle day. We also want to increase awareness about VTE in children and teens. And last but not least, we want to organize a 5K fundraiser for the fall of 2012. Everybody actually thought this was a great idea, and everybody was really willing to help with this. We can increase awareness about DVT and PE. We would use it as a fundraiser, as I would say. And if interested in helping to make these plans, you can contact Kathryn or myself, and this is our contact information.